Now we're moving on to disability income on your test. So take a moment to review any of the notes that were placed there for your convenience. I don't believe there's any diagrams. Then once you review, then let's stop, pause it so we can go over this test. So take a moment here and fill in your answers. Use a pencil. Nobody's going to grade it again. And then highlight the words that helped you to get to your answer, and then we'll go over it. So it's time to take the test. Now, welcome back. Let's see how we did. Number 1, an insured has a disability income policy with a $1,500 monthly benefit and a 30-day elimination period. He is unable to work for 120 days. How much would the policy pay? Well, first of all, he has to satisfy his 30 days. So 30 from 120 means he'll get paid for 90 days, which is 3 months. 3 times $1,500 is $4,500. Now let's move down here to number 2. A person has a 90-day elimination period and has been disabled 120 days. When would they receive their first check? Well, the answer is the 121st day, and here's why. The first 90 days are on the client, meaning no benefits would be payable. So starting on the 91st day through the 120th day, that is the next 30-day period that they'll have to satisfy. Now, whatever time frame, if they were off the full month, they'd get paid a full month. If they were only off 10 days, they'd only get off 10 days. But we're not going to issue the check until after the 30-day period would be over. So for test purposes, it would be the 121st day. Now, number 3, during the elimination period, no benefits are payable. That is true. And I want to warn you, the test does things like 30, 60, 90, 180 colon, and then you're going, what? And then your answer is no benefits payable, because you're supposed to know that means an elimination period. Now, partial disability is when a disabled employee is receiving lost income while working part-time under a long-term disability benefit. That's true. Now, the loss of sight in one eye would be what type of disability? Permanent. Same with the loss of a foot or a loss of a hand. But if you lose the sight in both eyes, that's what type of disability? That's presumptive. So total loss of sight, hearing, or speech is presumptive disability, and it says that under presumptive disability, you are total and permanent. And this is one of the rare times that we would just pay you off in a lump sum of money. But remember, only 1 is permanent, 2 is presumptive. Now, 7, under a disability income policy, bodily injury must meet the following criteria to be classified as accidental: is that only the result be accidental. Well, that's true. If you remember from your materials, we have 2 definitions. Accidental means both the cause and the result have to be unintentional and unforeseen. Where the accidental result, we usually call it accidental bodily injury, means it's only the end result that has to be unintentional and unforeseen. Meaning, in your disability income policies, we give you the better of the 2 definitions for an accident, because then it allows you to do dumb things. For example, if you were speeding on the freeway going over the speed limit, accidental result would pay, but accidental means would not, because you contributed to the injury. Now we're going to move on to number 8. And let me move it up. Now, a rider that provides payment when the insured is totally disabled but not yet receiving any Social Security benefits is the Social Insurance Supplement, the SIS rider. Remember, it's very hard to meet the definition of total disability with your disability with Social Security, but it depends on the definition used for you to be able to meet it when you buy an individual policy. Now, your next one is going to be guaranteed renewable is a policy the insurer reserves the right to change the premiums, but they may not change any of the policy terms. That is correct. Now, your renewal provisions is sometimes called a recall provision. So the recall/renewable provision that states the insurer may not renew the policy if the insured ceases to comply with certain conditions, such as continued employment, is called conditionally renewable. Then 11, guaranteed insurability option provides the ability to purchase additional insurance regardless of insurability. But in your disability income policies, you're going to have to prove your income justifies it. So you get to just sign a piece of paper, pay for the new addition. However, we're going to check the income because we don't want you to be overinsured. Now 12, renewal provision that the insurer has the right to change premiums for the same class of insured is guaranteed renewable. Anytime the test says change for the same class, zero in on guaranteed renewable. 13, the purpose of the rehabilitation provision in a disability income policy is to encourage disabled insureds to return to their original occupations. Well, true, or any occupation. It benefits us because if we didn't assist them with rehabilitation, they just sit back and collect their disability payments. Well, 14, the terminology commonly used, 30, 60, 90, 180, refers to the number of days that no benefits will be received. Then 15, when a recall provision of a disability contract is likely to change the contract the least and cost the most, this is non-cancelable. Now that means nothing can be changed. We guarantee that it cannot be canceled, non-renewed, nor can the premiums be changed on it. Now 16, a social insurance supplement SIS rider provides a benefit if the insured does not qualify for Social Security benefits. True. And then 17, the classification of accidental that is the most restrictive is accidental means, and it requires that both the cause and result be unforeseen and unintended. Now, I made a note there, this definition is not used for disability income. Now remember, the reason that's important is because disability income, you saw a test question that says, which definition do we use? And it's the result definition. Now 18, a disability policy with an own occupation clause, an employee who can no longer perform the task of the job held at the time of injury is considered totally disabled because we insured their ability to do their other job. Even though they can do another job, the own occupation definition is the least restrictive. Now for disability income policies, we're only going to be using two definitions on your test. Own occupation, so it's inability to perform duties of your own occupation, and any occupation means inability to perform duties of any occupation based on your education, training, experience. So any occupation is going to be more restrictive than own, means it's harder to trigger benefits. Now, what happens here is 19, when somebody is declared legally blind, they're considered to be totally disabled because part of presumptive disability is total loss of sight, total loss of hearing, or total loss of speech or two limbs. Now, what happens is, let me move this up. Insurers are prohibited from denying claims based on misstatements in their disability policy application after the policy's been in force for 2 years. So it's basically the same incontestabilities that they have in life insurance. However, in disability and health products, it's not called incontestability. It's called time defense on, defense on certain. We'll get to it. I'm sorry. But it's a limit on your time defense. Now let's move on to 20. Insurers are prohibited from denying claims based on misstatements in the disability policy application after the policy's been in force for 2 years. Now, 21. Insured pays less if the premium mode is quarterly instead of annually. False. They pay more. Remember, the more often that we have to handle the premium, the higher it's going to be. Now, 22, residual disability requires the insured to return to work after being totally disabled with a reduction in earnings of usually at least 20%, and they are classified as permanent partial, meaning that they cannot do what they did before, but they can still do some of the things that they did before, and they're not going to get better. 23, an occupational disability income policy pays for disabilities that are suffered both on and off the job. That is true. Occupational means on and off. Now then, 24, a policy that has a waiting period of 30 days from the date of issue before a claim would be paid. This is referred to as a probationary period. Probationary periods are always one-time waits that begin after issuance or after some event. That's how you know it's a probationary. Slang for that would be a waiting period. In disability income, we usually have a probationary period for sickness once the policy is issued. Meaning if it's issued with a contract date of June 1st, there's an additional 30 days before illness would also be covered. So the first 30 days only accidents would be covered. This is to reduce moral hazards. Now your next one is going to be the Social Security Disability Benefit Rider that pays benefits that match your Social Security benefit until the Social Security benefit begins. Poorly worded, but that's true. Now 26, your disability income policy is more restrictive if it uses own or any occupation definition, and the answer is any. Now 27, a disability income policy, is it a reimbursement or valued contract? Well, it's a valued contract because it states right on the face of the policy what will be paid at claim time. So it's agreed upon in advance. Now, then your next one is going to be, get down here. Then 28, loss of time and loss of income are two ways to say disability income. What that means here is that's not a test question. That is just so that you know, instead of using the phrase disability income policy, they might say loss of time or they might say loss of income. So that still means a disability income policy. 29, the return of premium rider will return premiums if the insured surrenders the policy in the early years of the contract. False. And 30, a disability income policy that covers the insured off the job is occupational, non-occupational, both, or neither. Well, the answer is both of them cover you off the job. It's only occupational will cover you on the job as well as off the job. Now 31, the insurer places limits on the amount of insurance to prevent overinsurance. In the past, there's been a test question on overinsurance, and overinsurance is when you have more insurance in place than the potential to lose, which means you would be making money. Now, benefit integration is used to prevent a moral hazard. True. That means that when we go to write a disability income policy, we ask the insured if they have any other policies so we can subtract it from the maximum they can purchase. Also, underwriting is going to be checking on that too, because I hate to mention it, but some people don't like their job, and if they could get the same amount of money coming in if they were disabled, they just might go out and step in front of that bus. Now, 33, malingering is considered to be a moral or morale hazard. It's morale. Remember, it is a lapse in judgment, but we're all guilty of malingering. What it is you ask the doctor for a little extra time off, so you're dragging your feet about getting back to work. 34, a period of time that must commence after the onset of disability before benefits begin is going to be an elimination period. So remember, probationary periods are after an effective date or after some kind of issuance. But when we want elimination period, it has to say after a disability. Now then, 35, premiums paid by an individual for their disability income policies are or are not tax deductible. Are not. I'm going to make it real simple. Individuals cannot deduct. Employers can deduct group plans and retirement plans. All right, but they cannot deduct an individual plan on a particular employee. Now, 36, employers' contributions towards an employee's disability income are not tax deductible as a business expense. False. That would be deductible. Then 37, if the group plan is contributory, remember that means both the the employee and the employer are splitting the premiums on any kind of percentage basis, and the employee is paying 1/3 of the premium for $3,000 per month of disability income benefit. How much would be taxable? Well, 2/3. Because if the employee is paying 1/3, the employer is paying 2/3, which is $2,000. So out of that $3,000 a month, $2,000 would be subject to income tax, $1,000 would not. Now 38, the longer the elimination period or the shorter the benefit period would increase the premium on a disability income policy. False. Now you're going to get these questions on long-term care also, as well as disability income. So elimination periods, remember, are deductibles in time. So we all know that the longer we wait, then the lower the premium. And the shorter period of time that the company has to pay, the lower the premium. So if you wanted to increase the premium, you would have a shorter elimination period or a longer benefit period. Now let me move this up and then we'll move on to the next one. 39, the most important rating factor in underwriting disability income is your occupation, and second most important is avocation, which is your hobbies. Both of those are due to degree of risk. Even though it's a consideration in writing a health policy, it's the absolute most important when it comes to writing a disability income policy. Now, individuals can deduct their premiums on a group disability income policy. False. Individuals cannot deduct whether they're getting the benefit through a group policy or they're buying it direct. Now, 41, total disability means inability to work based upon the definition used in the policy. True. And remember, for test purposes, we are only going to use own occupation and any occupation when it comes to disability income policies. Now 42, let's go here, is going to be residual disability is a loss of income, not necessarily of time or duties, can also apply to returning to work on a part-time basis after being totally disabled. Now then 43 is going to be presumptive disability. Assumes the insured to be total and permanently disabled for the loss of, and it means total loss of, sight or hearing or speech or any two limbs. This one settles lump sum because disability income policies under the mandatory provisions can pay you a weekly check, bi-weekly, but monthly is the longest we can go. So we can't pay you quarterly or semi-annually. Now your next one is going to be 44. If the insured is disabled for the same condition within 180 days, this is considered a reoccurrent disability, and the benefit would be that the elimination period is waived. So they immediately start back up into their benefits. And then 45 is partial disability, is when illness or injury prevents one from performing some but not all of their duties. It may also provide a benefit of 50% for 3 to 6 months. Well, we finished that section.